Robotic organ sparing exeresis of a large pelvic mass in a male patient. A 52 years old male was diagnosed with a 9 cm pelvic mass in the anterior portion of the mesorectum, indissociable from bladder and prostate. At the following biopsy, mesenchymal features were found. At the PET-CT scan, no distant metastases were detected. The patient initially underwent chemo and radiation therapy with only a partial downsize of the mass, reason why in June 2022 was planned for robotic exeresis of the pelvic mass. Here are presented the T2-weighted images of the multiparametric MRI. The surgery started with the medialization of the sigma. The ureter was found at the intersection with the external iliac vessel. The ureter was then followed distally, where it crossed the umbilical artery. The left vas deferens was progressively isolated distally, where a close relationship with the mass was appreciated. The posterolateral plane of the mass was carefully isolated, taking care of the internal iliac artery and the ureter. As could be appreciated from the multiparametric MRI and the CT scan, the vascularization of the mass was mainly due by vessels originating from the left side of the pelvis. After the closure of the pedicle of the mass, the anterior space between the mass and prostate and bladder was approached. Particular care of the ureter was taken since it was in close relationship with the mass. Progressing with the dissection more medially, the prostate was found. Also, the right vas deferens was identified. Unlike the left one, the right vas deferens was found not to be embedded in the pelvic mass. Conversely, the left vas deferens was completely fused with the mass. The dissection continued anterolaterally, where the prostatic pedicle was dissected and the endopelvic fascia exposed. Several tenacious adhesions were present between the mid-apical portion of the prostate and the mass. Finally, the anterior wall of the rectum was exposed. Taking care to safeguard it, the mass was gradually released anteriorly. The demolition phase ended with the release of the mass posteriorly. At the end of the procedure, the left vas deferens was sectioned and the mass put into the endobag. Here can be appreciated the good results of the surgery with the complete excision of the pelvic mass and the preservation of all the anatomical structures of the pelvis. Operative time was 250 minutes, while ABL were 300 milliliters. Urinary catheter was removed on postoperative day 4 with full recovery of continence. The abdominal drain was removed on postoperative day 5, while the patient discharged on postoperative day 7. No peri and postoperative complications were recorded. The histology of the mass was a solitary fibrous tumor. Currently, the patient is under oncological follow-up without evidence of disease.